Good afternoon, everyone. I am back with another tip for our seniors in our lives. Before I get started today, I would like to introduce myself. My name is Tammy, and I have been in healthcare sales for over 25 years. I am not a nurse, but I have seen a lot through the sales that I've done. I want to help you think about some things that you may not have thought about when it comes to your elderly parents. If you've seen my other two videos, we've talked about what they want towards the end of life. If something was to happen to them, this is what I want. Today, I want to talk about a couple of pieces of identification that you need to have on you in case something comes up and they are not able to speak for themselves. So let's start off with that. If you can, get a copy of their driver's license. A picture of the driver's license would probably work best. Whether they're still driving or not, see if they will allow you to get a copy of that. The second thing that you need is a copy of their Social Security number. Take a picture of it, put it in your phone, put it in your wallet, put it somewhere, because we don't know. We may get a call in the middle of work and doing anything, and somebody may call and say, "Is Miss Jones, is Miss Beverly Jones your mother? She may be here, she may be at this hospital," and then you go into panic mode and you just run straight to the hospital. So if you can get a copy of their Social Security card, or if you have a copy of their number, that would be great. Another thing that you need, and most people over 65 have this, you need a copy of their Medicare, traditional Medicare card, that red, white, and blue card. Years ago, that card consists of their Social Security number, and it may have had an A, a B, a D, or a W after it. But they changed all of those to numbers and letters because of identity theft. You need a copy of that number. Another piece of identification that you will probably need, if your parents do not have a traditional Medicare, but they have a Medicare HMO, and that will consist of maybe a Cigna, a WellCare, a Aetna, what's another one? Humana. If they have a white card and it says HMO, that's their insurance. But a lot of times, depending on what type of service they may need after hospitalization, they may ask, the company that they may have some type of home care or hospice with, may ask you for a copy of their Medicare number so they can check their benefits to make sure everything is correct. So that's four things that you need. You need a copy of their driver's license. You need a copy of their Social Security card, their Medicare card, and then you need a copy of their Medicare HMO card. Now, if your parents are still working and they may have a company insurance card, you need a copy of that. So if they're still working and they have insurance with the company that they're working for, then 9 times out of 10, that Medicare is going to come secondary because they're still working. Another thing, your parents may not be 65. They may not be able to draw Medicare yet or have that Medicare insurance yet. So, therefore, you would need a copy of that commercial insurance card. Some patients and some family members may not have worked the quarters that you need. So most people think that when you become 65, you automatically get Medicare. That's not how it works. you have to apply for Medicare. I believe it is 6 months prior to your 65th birthday. So make sure that they have that also. Make sure that Medicare has their correct date of birth, because I've seen numerous times where if you put the wrong birthday, if you tell me your birthday is July the 6th, 1935, but then they run it through the system because you're getting additional services once your family member is discharged and they can't find it. I can't find it. The system can't find it. That Medicare probably has the wrong the wrong date of birth. And that does happen a lot. So we want to make sure that Medicare has the right number. If Medicare does not have the correct, I said number, but I mean birthday. If Medicare does not have the correct birthday, then guess what? You have to go, for billing purposes, you have to go with the birthday that Medicare has. My suggestion would be to call Medicare, to get your parents to call Medicare to see if they can get that change. You're going to be on the phone for a long time, but at least they will have it. If not, then just go ahead and go with the Medicare birth date that they have. What else do I want to say? I think that's really about it as far as the type of identifications that you would need for your parents or your loved one when it comes to their insurance. It's still gloomy outside. I wish the sun would come up. If the sun would come out tomorrow, then we all can smile and say thank you for the sunshine, because when it's gloomy, you tend to feel a little gloomy. So I hope this helps you today on what type and what pieces of information you as their child, their caregiver, their POA may need to help them navigate through some of the things that may come up in the future. Don't forget to like and don't forget to subscribe, and I will talk to you on another day. Bye-bye.